Hi guys, welcome to my channel. So today we're going to discuss about hip joint examination. So first we go for the range of motion. So for measuring a range of motion, we are using a device called goniometer. So first to go for hip flexion. So for in hip flexion, the axis of goniometer is over the lateral aspect of hip joint using a greater trochanter of the femur as a reference. And stationary arm is lateral midline of pelvis and movable arm is lateral midline of femur using lateral epicondyle for reference. Then for the extension, so for extension, the axis of goniometer is over the lateral aspect of hip joint using greater trochanter of femur as reference, and the stationary arm is lateral midline of pelvis and movable arm is on lateral midline of femur using lateral epicondyle for reference. Then for hip abduction, the axis of goniometer is over the anterior superior iliac spine of the extremity being measured, and the stationary arm is aligned with imaginary horizontal line extending from one ASIS to another. And the movable arm is anterior midline of the femur using the midline of patella for reference. And for adduction, the axis of goniometer is over the anterior superior iliac spine of the extremity being measured, and the stationary arm is aligned with an imaginary horizontal line extending from one ASIS to another ASIS. And the movable arm is anterior midline of femur using midline of the patella for reference. For internal rotation, the axis is anterior aspect of the patella and the stationary arm is perpendicular to the floor or parallel to the supporting surface. And the movable arm is anterior midline of the lower leg using the crest of tibia and a point midway between two malleoli for reference. And for external rotation, the anterior aspect of patella is the axis and stationary arm is perpendicular to the floor, and the movable arm is anterior midline of the lower leg using the crest of tibia and pointing a midway between two medial malleoli for reference. So for the range of motion, go for hip flexion is 0 to 120 degree range normal, and for hip extension is 0 to 10 degrees normal. Hip abduction is 0 to 55 degrees normal. Hip adduction is 55 degree to 0 degree, and hip internal rotation is 0 to 35 degree and external rotation is 0 to 45 degree. Then you go for manual muscle testing. So hip, first to go for hip flexion. So for hip, what are the hip flexors are like iliacus, psoas major and tensor facilita. So for testing a hip flexor muscle, we ask the patient to sit in a high sitting position and therapist on the side of patient. And for grade 3, we ask the patient to actively flex the hip joint without bending trunk backward. If patient can do, then we go for grade 4 with minimal resistance on the anterior distal thigh. Then if patient can do with minimal resistance, then it grade 4. If then we give maximal resistance. If patient can do with a maximal resistance, then it grade 5. If patient can't do actively, then we go for sideline position. Then in sideline, we ask the patient to flex his hip. If he can do, then it grade 2. If he can't do, then we go for grade 1 and only palpate. Then the next one is the hip extension. So hip extensor muscle are like gluteus maximus and hamstring. So for gluteus maximus, we ask the patient to lay in prone laying position and flex his knee in 90 degree. Then lift his leg to extended his thigh and therapist stabilize the pelvis and posterior thigh. Then if patient can lift actively the thigh posteriorly, then it grade 3. Then we give minimal resistance to the distal thigh. If minimal resistance is done, it grade 4. Then we give maximal resistance. If patient can do maximal resistance also, it grade 5. If patient can't do actively, then we go for sideline position, and from full flexion we ask the patient to do extension. If patient can do, then it grade 2, and if patient can't do, then we go for the palpation. It only for gluteus maximus. If we test for gluteus maximus and hamstring both, then we just extend the knee and do the same test as it. Then go for the hip abductor. So hip abductor muscles are like gluteus medius, gluteus minimus and tensor facilita. So in this for this test, patient is in sideline position, affected leg is up and normal leg is down and flex. slightly. Then therapist stabilize the pelvis and ask the patient to abduct his arm actively. If patient can do, then it grade 3. Then we give minimal resistance for grade 4 in the distal lateral thigh. If patient can do, then it grade 4. Then we give maximal resistance. Uh, if patient can do maximal resistance, then it grade 5. Then if patient can't do actively, then we go for supine line and ask the patient to abduct. If patient can do, then it grade 2. Then for grade, if patient can't do, then we go for grade 1 only palpation. Then for hip adductor muscles are like adductor longus, adductor brevis, adductor magnus, pectinus, gracilis. And for this test, ask the patient to in sideline position, affected leg is lower and unaffected leg is in above. And as the therapist abducted his normal leg and asked the patient to touch the affected leg to the normal leg. If patient can do actively, then it grade 3. Then we give minimal and maximal resistance in the distal thigh. If patient can do, then it grade 4 and 5. If patient can't do the active movement, then we give a supine line and fully abducted position to ask the patient to do adduction. If patient can't do, then it grade 2. If patient can't do, then we go for grade 1 only palpation. Then for internal rotation, so internal rotation muscles are like gluteus minimus, tensor fascia lata. So this position, therapist ask the patient to in high sitting position, therapist stabilize the lateral middle side of the thigh and give resistance to the ankle, lateral side of the ankle, then or lateral malleoli. Then we ask the patient to do internal rotation actively. If patient can do, then we go for minimal and maximal resistance to the lateral malleoli. If patient can do with minimal resistance, then it grade 4, and if grade 5 if with maximal resistance. If patient can't do, then we go for supine line and just ask to internally rotate the leg. Then we go for the next is the external rotation. So for external rotations, muscles are like obturator externus, internus, quadratus femoris, piriformis and gluteus maximus. So same like internal rotation, only just give the resistance to the medial malleolus, and it's same like internal rotator. Then we go for the joint play. So what are the joint play in the hip joint? So first one is the anterior glide. So for anterior glide, patient is in supine and the forearm of one hand under the middle of the shaft of the femur, and with the other hand, therapist push downward at the distal end of the femur. And then for next one is the posterior glide. So for posterior glide, patient is in supine line, hip is slightly flexed, therapist embrace the thigh of patient with both arm and push it downward direction through the forearm. Superior glide is not possible in hip joint, so then you go for the inferior glide. So inferior glide, patient is in supine, hip knee 90-degree flex, and ask therapist just pull it towards upward direction and or towards himself is called inferior glide. Then for distraction, patient is supine line and therapist just give distraction to hold the ankle with both the hand and give distraction to the hip joint, and pelvis is stabilized with a stabilization belt. Thank you.